think we end up being ultimately accountable for safe staffing across every complex population in our organizations. And I think for me, it's less about those numbers and more about being flexible to the acuity that fluctuates throughout the day and also that volumes fluctuate throughout the year. And
Hmm.
so I think it's being able to staff up when needed to ensure those ratios and also flex down when our volume goes down to, potentially give a day off to a nurse who has a well-deserved day off coming. And so I think that it's our job and opportunity to provide our nurse leaders as well as our nurses mechanisms to plan effectively for that. So we plan, staffing around seasonality. We see higher spikes of volume in the winter and lower census in the summer. And so how can we strategically staff to ensure that that's happening? How do we budget from a financial perspective to ensure that we have what we need for our teams? And so I think, CNOs, we're ultimately responsible for tools and resources and making sure that we have those mechanisms in place in our organization. And I think that is how we lead this work. And I think ultimately it really depends on flexibility and adaptability and being able to build structures that support flexibility and adaptability. It's really interesting that you asked this question because we've had, surges in our emergency department as well as our inpatient areas over the last 2 months, 3 months. And one of the ways that we're really addressing that is flexing staff between departments. So we
Mm.
may send an ICU nurse to the ED to support until that patient is more stabilized or, they don't need an ICU admission anymore. We also are floating nurses between areas. So, if a med surg nurse can go support in a different med surg unit, like we're flexing that way too. And so we're really trying to make sure that we're focused on each patient receiving the level of care that they need and also being able to flex up when necessary, meaning that if a patient's acuity changes, then we can make sure that they're getting a one-to-one if they need it. Or if their acuity is not as critical, then we can flex down and make sure, that that's happening as well. So we really want to make sure that we can meet the needs of our patients. And I think we're less focused on the numbers and more focused on how do we be adaptable and flexible to get our patients what they need in those moments.